Hello and welcome, everyone. My name is Nicole Christensen, the proud founder of Answers for Care. Answers for Care is a one-stop shop for Long Islanders looking to provide care for an older adult. It really runs the gamut, and we'll talk a little bit about the site. Today, we are going to talk about healthcare, care, and support services, why we need them, when we need them, and who should we go to get those services. So let's talk about the site first. For all of those that are new to the site, it's we are young and strong and growing by the day. So it is a one-stop shop, as I said before. And here we go. All right. So this is the Answers for Care site, the Village of Senior Care Solutions. And this was created, I'm a board certified patient advocate. And this was created because I know it takes a village to provide care for our loved ones. And so this is supposed to be the easiest way to get vetted professionals that you know are going to be the best and will really and truly meet your needs. So one of the things that all of our pros on Answers for Care go through is a background check. So those who own the or represent the agency, they go through a criminal background check and their business goes through a background check. So all of them are vetted. The other thing to know is that they will get back to you within 24 hours. So you see this here, those of you who can see my screen, we can look and we see that verified. That means that they are indeed vetted. The other thing about our pros, they are at least a 3-star rating. Everyone on here now is 4 and 5 stars on their professional industry sites, as well as their different social media and rating sites. So again, we really are trying to get the best of the best. We understand that families and seniors themselves are in vulnerable positions and we need answers fast. So how do you find these answers on this site? Again, trying to make it as easy as possible. It's kind of choose which way you want to do it. So if you were to say, okay, I know that woman's name was Nicole. Let me see. I'll just put in here a keyword or name. Same thing with the name of a company. You put it in there and let's see what we find. And then you'll see Answers for Care, right? Care Answered, sorry, which is my business as a patient advocate. You can view the listing, see everything that they have to say about themselves. If you contact, this is the other badge here where it says Answers for Care with a check mark. That says that that person and that company is vetted. You put your information here on contact Care Answered or whatever business it is, and they will get back to you within 24 hours. So there's lots of ways. Now we go back to this. We also have categories. Like I mentioned before, we're talking about navigate care and support as well as healthcare today. Last month, you can check it out on our website. We did in-home care. And then the month before that, we did legal and financial experts. So it really runs the gamut. You'll see here when I put in healthcare, you will see, hold on, I'm sorry, let me just move myself here. You will see the different kinds of services. So this is financial, this is in-home care. There's examples of the different things that they offer. So you can go and find somebody that way. So you said, okay, dementia specialist, let me see. These two actually are both nonprofits. They are vetted through GuideStar. They both are rated very high, and they offer different services. Right now, they are not subscribed, but you can definitely go there, figure out some information about them, and go directly to their website. So again, many different ways to find the expert you need. You can also put in your postal code. I don't suggest that because many of the professionals here, where their physical location doesn't really tell you where they serve. So you don't want to limit yourself there. Um, so let's go back to what we're talking about today. Oh, let me actually go back one other second and tell you there are lots of people that have no idea what they need. They just know that they need help, and that's pretty common. So again, we try to make it clear to you if you look at the site, different newer professionals, and there's also premier uh, providers that have blogs up monthly of very interesting facts there. And then here you'll see unsure of what you're looking for, right? So if you really don't know, and this is supposed to be a little primer, a little help to give you some idea if you haven't seen this video or you did and you forgot. It gives you kind of an idea of when you would go for or look for different professionals. But even if that, you're like, that's a lot of words. I can't, I'm too overwhelmed to do that. You can just hit contact, fill out this form, and we will get back to you within 48 hours. Even if that professional that you need is not an Answers for Care, we will do our best to help you find whatever services that you need. So we're really there for you. So now going back to what we're talking about today, which hopefully you're now back on the Answers for Care screen for this webinar. We, again, are talking about healthcare, care support services. So what does that mean? As I mentioned before, when we went through the site quickly, what's included is dementia specialists, like we saw, home physical therapy and occupational therapy. So services you can get in your home. Mental health services in the home, wound care in the home, patient advocates, like we talked about, geriatric care managers, end of life doulas, and in home critical medical care. So, those are some examples of what's in this category. As I said, there's 4 categories so far. So, dementia specialist is, when do you need one? Says here when you or a loved one has a dementia diagnosis, but I'm going to add to that a little bit and say when you think that potentially there might be a dementia diagnosis in the future. I say that because these are not doctors, they're not clinicians, but they can help, just like a patient advocate can do, help you steer you in the right direction to get the answers that you need. And if there's short-term memory loss for you or a loved one, you're still going through things, and you might need the different kinds of supports, even if it's not actually dementia. So it is definitely worth a call and a reach out. And you just want to know, again, what supports are available for both the person with the diagnosis or suspected diagnosis, as well as loved ones. And why? The simple answer is patient and family want support in the dementia diagnosis, and they want quality of life. The truth is that we see it often that somebody to the outside world, they have a dementia diagnosis and they'll see some changes, and people will say somewhere within the diagnosis maybe that they're not the same. They don't like the same things that they used to, but their spirit is still there. They're still there. So that quality of life is necessary, and it's finding what brings them quality of life now for both the caregiver or the loved one, as well as the person with the diagnosis. And they have support groups for loved ones and patients. Again, programming for quality of life, respite for caregivers, and what I call low and no cost good times. Just that quality time and having a good time with people that may be going through a similar situation, and or can just have a good time together, because it sometimes can feel very isolating. And know that you are not alone, and there's these great services that can help you. And where do you go to find it? Answers for Care, the professionals on Answers for Care. Now, at-home physical therapy and occupational therapy. Those are two different things, but if you look up one on Answers for Care, you're going to get both. Okay, so they generally have physical therapy and occupational therapy, maybe not the same person, the same therapist, but they generally have both. So when do you look for this? When are you thinking about that? When someone is feeling more physical limitations, right? They don't even know why. They may not even know when they hurt themselves. Or perhaps they had a recent injury, or they're recently been discharged from a skilled nursing facility. So I'm going to just share an example with a call I had a couple of days ago. A gentleman had injured himself and he wasn't hospitalized, but he was in pain. His shoulders were in pain. And so they were going to do an MRI, and he'd already spoken to them about seeing a orthopedist. And what I said was, just bring up physical therapy and occupational therapy because it can help in so many ways. And why? Because it can improve movement and capabilities, decrease pain when doing ordinary tasks, and strengthen you and help you move more easily. So these are things that we want. And again, on Answers for Care is when you can find these great professionals. And in this case, they come to your home. And let me just say one other thing about that, going back to the occupational and physical therapy. They often take Medicare insurance. It's the Part B, oftentimes. Sometimes they take others, but just know that it's not necessarily coming out of your pocket. It oftentimes isn't. So it's worth a call. If you haven't been recently in the hospital or skilled nursing facility and it's not coming from a CHA, which is a certified home health agency, then you can still potentially get it paid for by insurance. You may need a doctor's prescription for the physical therapy. Now, wound care in the home. When do we need that? When you or a loved one has a bed sore or other wound that needs care. Oftentimes, we find this after a hospitalization, but sometimes not, right? Sometimes we have a wound for whatever kind of reason, and we are homebound, and we need that care at home. So why? Because wounds can be deadly if not treated. There's no question about it. Unfortunately, we've probably all heard of some horror story. But if not treated correctly, it can kill you. It's an infection, right? And it can take over very fast. So you want to make sure that you're getting that taken care of. Or you need a wound care treated at home where you're most comfortable, right? So this is in-home wound care. And again, where do you find these professionals? On Answers for Care. Now, this is interesting and new in my world, but I've heard very great things, is ER and hospital care at home. And when do you need that? When your loved one is an older adult and in need of hospital level care. Again, this is kind of a new phenomenon, but can save people's lives. And why? Because emergency rooms are often crowded and can leave older adults even more vulnerable. Unfortunately, we've all seen that. I know what comes to mind first is COVID. But even, thank God that we don't have that disaster or emergency right now, it still can be crowded. We have waited hours and hours. And for an older adult, that can be more detrimental. Or you have complex needs and feel that you would better heal at home. So again, where can you find this? Answers for Care. Patient advocate. I'll try not to spend too much time on it, but I have a bias, right? So a patient advocate, when do you need that? So when a caregiver or patient wants the best care but is overwhelmed and once expert assistant navigating the healthcare system at home or in a healthcare facility. And why? Because not knowing or understanding your options can lead to disastrous results. It's very hard. Anybody who has heard me speak, I probably say it ad nauseum, but if you don't know what your options are, it's pretty impossible to know which is the best option for you. So it's just so important to know your options. Another reason why is you're scared, overwhelmed, or feel unheard regarding the care of yourself or a loved one. A patient advocate can go there and help you amplify your voice to make sure that your concerns are heard and met. You're a patient or caregiver and you need help getting the best care. Again, those are all reasons to seek out a patient advocate. And as I think I showed you, there's more than one patient advocate there. I have a colleague, Kathleen Quinn, that does an excellent job as well. So know that you have options. Then there's a geriatric care manager. I know for myself, people often ask what's the difference between a geriatric care manager and a patient advocate. And it kind of depends what the patient advocate does, their specialty, and what a geriatric care manager does as their specialty. But oftentimes when we need them, if you or a loved one is alone and needs help. Why? Because an older adult lives far away from loved ones. Two, they need help with constant complex medical and social needs. So sometimes geriatric care managers will define themselves as, the daughter. They're their surrogate daughter, good daughter. And so that's what they can be, and they can be super helpful. I've worked with geriatric care managers as with Care Answered, we really get in there for the transition of care. So when people need ongoing care, we definitely utilize our colleagues in geriatric care management. And who do you use? And where can you find them? Answers for Care. End of life doula. This is a fairly new field as well, probably about 10 years old, probably a little bit younger than patient advocates, but so essential. So when you hear doula, you think of birthing, most people do, but this is the same kind of thing. It's a transition of life, and they help with the end of life needs. So when you or someone you love has been diagnosed with a life-changing illness or terminal diagnosis. Okay, so that's when we need, and why? Because this is a very challenging time and it needs support and compassionate care. That's both for the loved ones and the person with the diagnosis that's at their end of life stage. And they really give patients autonomy over decisions, and both loved ones and patients are given space for communication, spiritual, and emotional well-being. We all know this, but for whatever reason, our culture kind of says, don't think about it. But the end of life is part of life. We have stages of life, and they are, all of them are just as important. I know for me, I want the end of my life to be filled with that quality, and for all of my loved ones as well. So an end of life doula can truly make that happen, even before it's end of life, actually. And so where can you find them? Answers for Care. So that's what I have for today in that section. I thank you so much for joining me. Please, if you'd like to ask any questions, please feel free. You can find Answers for Care, of course, answersforcare.com, on the internet, as well as all the social media stuff. We're trying to get information out there to you. And if you actually have a professional that you've worked with that you love and think would be a good fit, that's a great reason to contact us too. Again, we want the best of the best for all those that are utilizing this site, and you can help us do that. So thanks so much. Any questions? Sure. Put yourself off mute and ask.
Yes, I did. Nicole, I love the way you present the material. I always your voice and the manner really convey care for people.
Thank you.
Yeah. I wonder, because your telephone number is 516, do you serve only the Long Island area?
Yes. So Answers for Care,
Mm,
that is serving Long Island
mm,
seniors.
mm.
So we're hopefully going to be growing soon to the 5 boroughs and then beyond. But as far as Answers for Care, the professionals serve Long Island. Some of them serve other areas, and you'll see it on their sites, the professionals, but this site in particular is for Long Island, Suffolk, and Nassau counties.
I see. And the professionals affiliated with your organization, do they speak languages other than English?
Some of them do. Yep, it'll say so on their
Criteria,
profile,
the
if you will.
description?
Yeah,
Okay.
yeah, absolutely. That's a great question. That's a
Okay.
great
Thank
question.
you.
Is there a language specifically that you have a
In
need
mind,
for?
yes, Mandarin.
Mandarin. Okay. I don't know. I don't know who speaks Mandarin, like for home care agencies.
Mm.
Hopefully they'll say, we have different kinds of languages there. That's a good thing for me to remind the professionals on here to put on there.
Thank
Um,
yes.
but that's where it should be in their profile.
Mhm.
Okay.
Thank you.
You're welcome. Any other questions?
I have a quick question.
Sure.
I had a call last week, and I'm not really sure, whether it's done or not, but someone was asking if they know of a physical therapist that would go to a rehab center. Apparently, the insurance part had run out, so they were no longer able to get physical therapy in the center, but the person was still there and still needed help.
Well, I'm going to put my patient advocate hat on to answer that question. So generally, the rehab are not going to allow an outside
That's
uh,
what I kind of figured, yeah.
a physical therapist to come in, but I have with
Mhm.
my clients have arranged for them to be for transportation to an outside physical therapist, meaning not an in-home one, but ones that have actual
Okay,
facilities outside. So that's something that they
okay,
can do, which may not be covered,
all
right?
right,
You'd have to probably pay out of pocket
yeah,
because,
right,
if you have Medicare, it's not going to double pay, or no insurance is going to double pay, but
right,
that is an option.
right, right. Okay,
Thanks
good,
for asking.
thank you.
Any other questions? These are good questions, everybody. All right. Well, thank you. Enjoy this beautiful day. Stay cool. Hopefully you have air conditioning. If you do not, find a cool place to be. Um, and I'll see you on the interwebs. And feel free to reach out for anything.
Thank you so much for your
Take care.
presentation.
Bye-bye.